A very pleasant Tuesday morning. Time for Money Info, brought to you by Princeton Research. Don't forget that research paper comes out every Sunday, written by the hosts of the show. One Michael King out of lovely Las Vegas, and Charles Moscowitz out of Beantown. And Michael, a very pleasant good morning to you.
Oh, thank you. Same to you. It's been busy already. Very busy.
Yeah, well, that's good if you're busy. That's great news.
Well, all the action came from Italy. The Prime Minister signed another Brexit coming from Italy.
Mm-hmm.
And the China market was down 1%. But when Europe opened flat, it engendered a rally. So we got a rally, even though the news is unsettling.
Well, it's so funny. I mean, it's of course now you've got 60 Minutes turning into the Sports Illustrated jinx for that that young president of Italy who was the featured guy last week, and then all of a sudden turns around and loses the election following week. Very interesting. But I guess what? Austria went to a real conservative person, right?
That was unusual.
Yeah. Yeah. Boy, I'll tell you, it's very intriguing. But back here at home, Pressure Biosciences continues to make news. Is that correct, Mike?
Absolutely. And we have Rick Schumacher, the president, on with us to discuss the biological sample preparation that they do.
All right. Hey, how you
doing? Good morning or good afternoon.
Yeah, how you doing, Rick? What's going on?
I'm doing great. We're having a bunch of our first little snowfall of the year up here in Beantown, but
that's what I heard.
Nothing to get worried about.
Oh, my. Yeah, well, unless you get about 5 or 6 feet, I mean, that's just, so what? It's a dusting up there.
It's a dusting, right?
Yeah. Well, tell us, what's new since last time we talked to you guys a while ago?
Sure, Greg. Happy to. First of all, remind everyone that we are a life science tools company, an instrument company, which means we make instruments and consumables. It's a razor blade story that we sell into the very large research community around the world, primarily what we call the biological community. These are researchers that are spending their lives studying viruses, bacteria, cells, human, plant, animal cells, microbes. They're studying cancer and pre-cancer and normal, and they need instruments in order to break these cells open, because all the things we want to get are inside the cells or on the cells. So we need to have a way to break open. It's a critical part of research is what we call sample preparation, preparing the sample. Remember, the sample can be made up, the cell can be made up of as many as 10,000 different proteins and maybe 1,000 different lipids, and of course it has DNA and RNA inside it. And we've got to get these biomolecules out in order to study them. We've got to figure out what makes the difference between someone that can accept anti-cancer therapy and someone that can't, someone that comes down with a disease or disorder and someone that does not, developing a therapy, developing a new drug regimen, a new strategy. We've got to get all these very important biomolecules out. And so we've developed a whole new way, very different than what's been out there for the last generations, in fact, Greg, generations that are using very mechanical means to break cells, just busting them up. And what we do at Pressure Biosciences is we use Mother Nature. We use pulses of pressure. We put cells in a tabletop pressure chamber, what we call a barocycler, and we cycle pressure onto the cell. We put the cell inside of consumable test tubes, and we fill them with buffer, and we close the lid, and we dial in a computer, and we pulse pressure back and forth until we break the samples, until we break the cells. And it's very controllable. It's exquisitely controllable. Pressure moves at the speed of sound. It's very quick. It's very uniform, which gives the type of reproducibility that research scientists actually need. So that's what we do for a living. and it's been very exciting, as you know, and Mike knows here, for the past, I'd say 2 years for sure, but certainly over the last 6 months, we've had a number of successes, a number of accomplishments, and sort of a lot of that kind of culminated in an article that came out this week on mass spectrometry, which is the $1 million machine that research laboratories all over the world use to study proteins. It's the gold standard for studying a protein, but something has to sit in front of this $1 million or $500,000 machine to break open the cell to release the proteins, and that's where we come into play. And there was an article that was published earlier, actually it was published on Friday, and it got picked up by a number of great online magazines such as Barron's, Wall Street Journal, and Market Watch, and many, many others. So we're very excited about that exposure, and about that article, which is now available on our website, which is pressurebiosciences.com, and it's available right there on our website, or you can go to barrons.com or any of the others and see that article.
Wow, couldn't you get in any of the major publications? You just named off the who's who of financial journalism there.
Yeah, it was great for us to have that article picked up and to try to get that exposure, to let everyone know. You know, we've been told that we're the unknown company. We're a small company in Boston, and but we're starting, we think, to make bigger waves. We have a technology we're very proud of, but more importantly, we think it offers scientists a better way than what's out there to break open those samples, to get to those biomolecules. We have some of the key opinion leaders in the world now, key opinion leaders like Professor Aebersold at the ETH in Zurich, Switzerland, generally regarded as one of the top technical schools in all of Europe, if not the world. And he runs the Institute for Molecular Research, and Professor Aebersold has published a number of papers, including one about a year and a half ago in Nature Medicine, a major journal, about the advantages that he sees in using our system to break open cells prior to taking what you get out, the proteins out of it, and putting them through instruments such as the mass spectrometer. So we're very excited. It's been an exciting year for us. As you know, if I have a couple of minutes, I can just talk about some of the achievements that I'm very proud of from my guys this year. I think we started off with a bang by signing a deal with a subsidiary of the Danaher Corporation, which is about a $70 billion company. We did a deal with SciEx, which is, from what we've read, they have the largest market share in the world of selling these mass spectrometers, reading proteins for protein work. We signed an exclusive 2-year deal, a co-marketing deal with them, and it's just really starting to get legs, in our opinion. It takes a while for two companies after 6-7 months to get to know each other, and we're looking forward to an expansion of that program and an acceleration of that program. So it's great to have one of the top laboratory instrument companies in the world as a co-marketing partner. We retired all of our floorless debt, which means that all of the debt that remains on our books is what we would consider very safe debt. It doesn't change. It can be only converted into a single price of stock. We've developed this new instrument, which we call our next generation instrument, and very proud to say that the first 3 that came off the drawing board and were manufactured went to a leading cancer research lab in Australia that has actually now been named part of the Cancer Moonshot, Professor Obama's Cancer Moonshot, that is going to try to take in the next 5 years and do what normally might take 10 years to do for cancer research. So very, very happy and proud that our first 3 next-generation instruments have been chosen to be part of that program by being purchased by the Children's Medical Research Institute in Australia. So a couple other things, Mike and Greg, that I'd like to talk about. We announced just a couple of weeks ago that we received $610,000 in an equity PIPE investment And we also announced a $2 million line of credit, which has given us the ability now to begin to hire more people. And we've just today started to put in an order for 25 to 30 parts for 25 or 30 more of our next generation instruments. This is what that line of credit means to us. And I guess, most of all, we announced our third quarter earnings just a week or two ago, and we talked about the fact that we had not just a record quarter in products and services sales, but also a record 9 months. So it's been a great year so far, and the year's not over. And so we're looking forward to finishing December strong, and also very much looking forward to 2017.
Boy, that's amazing. Of course, you mentioned the website, but you do have a stock symbol as well, PBI. And
PBIO.
PBIO, okay, on the OTC, right?
OTCQB.
Uh-huh. Perfect.
Yes.
Yeah.
Pressure Bio, PBIO, and the OTCQB. We're very, we've been on the QB now for about 5 years, and I tell everyone we run the company as if we were a NASDAQ company. We feel very strongly about all of the rules and regulations that we should follow, and so all of our filings are certainly available. Also on our website, pressurebiosciences.com. You can go there and find all of our SEC filings. You can find information about the product. You can find information about our customers, and I think it's all there. But as always, we're happy to take phone calls from anyone that needs more information.
You know, it was very amazing. You talk about the moonshot article that was written on the street. And what really amazed me, Richard, was the fact that, you look down the page here and you look and see Merck and, Bristol Myers and then Roche and Pressure Bioscience, all among the big guys, which is, I think, absolutely amazing. And folks need to see this article too. It's on the street. You can still get it on the web, and it's called "Cancer Moonshot Should Benefit Pharma Companies and Investors." And it's absolutely fascinating article. And you're right there with the big boys, which I love. I think that's great.
Well, we're very excited about the area we're in. We think it's a very big area. We think it's very large and growing. We know for sure it's a critical area of scientific research. We know, the old axiom, garbage in, garbage out. We used to use that a lot for computers. It's very, very real when it comes to scientific research. When you're researching and looking for the next best drug, you're looking for the next strategy to try to control an infection or prevent prevention or cure someone. If you're trying to figure out why some people get a disease and others don't, why some people respond to therapy and others don't, we need to look at all of the biomolecules that are in a cell. And if we break up the cell in a way that can change or distort, or maybe even not get out all of the important biomolecules in that cell that we need to look at, then it's going to limit the research. And so we feel strongly that this method we've developed called pressure cycling technology, we're actually squeezing the cells. Like instead of taking a hammer and a chisel and a saw and breaking up a sponge, we squeeze the sponge. We squeeze things out of the cell. We can determine how much pressure is needed, and how long to be under pressure, and how many pressure cycles. And many times we can get things, it's been reported by a number of key opinion leaders, I'd say 5 or 6 papers out there already that say that they are finding molecules in the cell, different proteins in the cell, that they haven't seen in that cell they've been studying perhaps for months or years. So we're excited to bring a whole new way of allowing a research to accurately, we think, break open that cell, to, we think, give them a better chance to make that next discovery.
So you talk about the Children's Hospital in Australia. When will they actually start beginning studies?
They actually have. There was a big gala opening about a month ago or a month and a half ago. We were invited, and we sent our head of R&D, Dr. Lazarus, there, and he presented. He was asked to present along with SciEx and Beckman Coulter and some other companies. He was asked to present, and he presented to a group of very important people from both scientific and political from around Australia and around the world. And their goal very lofty goal. Their goal is to test 70,000 tumor samples over the next 7 years, and they're talking about it might even be more than 70,000. And for every one of these samples, they need to break that tumor up and get out all of that information from all of the proteins and lipids and DNA that's in this tumor. And so 70,000 samples are to be studied over the next 7 years, and they've chosen our system to do the upfront breaking of the cell. And we know that they're not the only game in town. We know that there are many, there are hundreds, if not thousands, of laboratories that are studying cancer. They may be part of the cancer moonshot, or they may not be. But if this group, which we have a lot of respect for, Children's Medical Research Institute near Sydney, Australia, if they think this system is good enough, we're now reaching out to their sister organizations, to other cancer research centers throughout Australia, throughout the world, and letting them know that this new 21st century method of breaking open a cell, you don't have to hack away, you don't have to bang and manually break it. You can use pulses or cycles of pressure, and we have now multiple papers, over 100 manuscripts that we can provide these other cancer research centers around the world and say, here's what so-and-so and so-and-so and so-and-so are doing. And when you have key opinion leaders that are publishing and putting their name and their institution and saying, this is the method we use, and we found this method to have the following benefits, it's very exciting for us.
Yeah, and I mean, the limited number of cutting that you could do to a human would probably be very apropos, I would say.
Well, these cells that we're getting are very rare. Sometimes you only have a limited amount. You can't go back to them once you've used them. So you want to use the best possible way that you can to break the cell to release all of those proteins, lipids, and DNA that's inside the cell. And it could be one tiny piece of one protein out of 10,000 that makes a difference between life or death, between developing a drug and not developing a drug, between finding out why someone is able to take a certain therapy and someone can't. So it's that one little tiny change. And what's important, that's why sample preparation it's not sexy, but it's critical. It's absolutely critical to the downstream results that you get. We actually have a slogan that we use that we say, discovery starts with sample preparation. That's a slogan that we've been using for about 7 years now.
I like it.
Discovery
Yep.
starts with sample preparation. So important, guys.
Yeah, that sounds absolutely amazing. So you've got to get it right the first time. That's the key. You've got to get it right the first time. And that's
well,
your system
if you don't get it right, there's a couple of problems. First of all, you may run out of the sample, and number two is you may not know what you're missing, and that's one of the problems we've had as a small company in educating the researchers, which is why it's so important recently that the key opinion leaders are lining up, and we have over 100 publications. Because if you're used to breaking open a prostate cancer cell or a breast cancer cell, or a bacteria that's causing rot in broccoli, or whatever you're studying, you're used to getting X, maybe 500 or 4,000 proteins. You don't know what you're missing. And so now that we have other papers being published by key opinion leaders, we now can show that, hey, you could be missing certain proteins that could be coming out, and you're missing it perhaps because you're not using our system. So it's exciting that now our sales this year, which we mentioned were record sales, we don't have a large sales force. We have one person, one field salesperson, and she's actually working half-time in marketing now, working with the SciEx group. So how did our sales go from a couple $100,000 to 300 to 400, now to 3 consecutive $500,000 quarters when you don't have a sales force? It's coming because the scientists are beginning to read the publications from the key opinion leaders, and they're picking up the phone and calling and saying, we saw this paper about this disease, or about diabetes or cancer or heart disease, and we'd like to know more about your system. So it's really been very beneficial to have these key opinion leaders publishing and presenting data using our system.
Well, I think it's you've got an amazing story, and I think what is truly amazing is that you're working with very prestigious hospitals in this whole situation too, and for a company your size, I think that's truly incredible. I think you're onto something, and you never know. You may become the New England Patriots of bioscience. You don't know. Well, maybe come to think of it, you may not want that bad rap. But anyway,
80,000 labs out there. How unique is your system?
It's very unique. There are, we think, 80,000 labs that are doing biological research that have to, in almost every case, have some method to break open a cell to get to all of these biomolecules. And of those 80,000 labs, right now we have a little bit less than 200. So we have a ways to go. I tell people that's a double-edged sword. Yeah, I can say, yes, we only have 200, but we're a small company and we're growing. And we want to be a big company. And as you guys know, I've started 3 prior companies that have all done very well. And I think this technology is as good as any technology I've ever had, and I've been in this business for 44 years. This is the best thing I've ever been blessed to have. And so the answer is there's a lot of potential out there. Our job is to grow this company and to try to grab as much of that potential as possible. And the way you do it, that we believe, and it's been successful in the past, is and this is what we're doing. You get the key opinion leaders to latch on, and they start to publish and present, and you've got a whole army. You got Arnie's army. You got the whole army there of biological researchers now that are coming to help us because they're talking about their results and how they got them, and they used our system.
Phenomenal. And, for folks who are on LinkedIn, they can certainly follow you there, Facebook as well. But it's on the web, pressurebiosciences.com. And, of course, you're also on Twitter, too. So one way or the other, they can keep up with Pressure Biosciences, Richard. I'll tell you, you got a lot to be proud of. I mean, when you're talking about sales the way you have for the last 3 quarters, my goodness, that's phenomenal.
It's a great story.
Yes, it is,
great
Michael.
Stock. PBIO is some.
Yep, and the key, as Richard just mentioned too, it may be OTC, but they run it like a NASDAQ company, and I think that is really, really important. And boy, I'll tell you, Richard, great news, and keep it going with Pressure Biosciences.
We intend to do that. We're working very hard here, and we know what we have. There's my 3 key people have been with me now for over 10 years, and I'm very proud that this team has been together now for over 10 years. And it's one of these things where you work hard, you wonder if it's ever going to happen. Now we can kind of feel and taste it. We feel like, now that organizations are picking up and writing stories on us, and we're being picked up by some great magazines, and most importantly, we're being picked up and are being used by some of the top researchers in the country and the world. Very excited about all of this, and very blessed to have this technology and to have the people I have, and looking forward to ending the year strong. And 2017 is, we think, going to be an extremely exciting year. This is one of those where you want to go to bed and wake up and it's 2017 because we're so excited about all the things that we have planned for 2017.
Boy, that's
story. Thank you very much.
Yep. Yes, it is a truly amazing story, and we'll be looking forward to 2017 from Pressure Biosciences. Richard, you have a great day, okay?
I will. You guys too. Thank you for having me on.
All right. Richard Schumacher, the president and CEO of Pressure Biosciences. Michael, what an amazing story with their sales being what they are for the last 3 quarters, huh?
Yeah, great story.
Yep.
And now we have Terry Howlett joining us.
Ah,
Invisible.
good friend of the family. Hey, Terry, how are you?
Hi there. Hi, guys. Good morning. How you all doing?
Hey, we're doing fine. So tell us what's up with Skin Visible and Kintari.com.
Well, I think that a couple of things that are really really moving fast for us, and I want to just hit on a couple of those today. One is our hand sanitizer, DermSafe. We've talked about in the past. This is the hand sanitizer without alcohol. It uses chlorhexidine glutamate as the active ingredient. It's approved in Canada by Health Canada. We will seek later approval in the U.S. for the product as well. But the benefit is that when it is applied to your hands with our polymer development, our polymer delivery system, I should say, in Visicare, it binds the active ingredient, chlorhexidine glutamate, to the skin for a minimum of 4 hours while continuing to kill bacteria and viruses that it comes in contact with. So from a hand sanitizer point of view, the market is owned by alcohol, which is instant, but as soon as the smell is gone, so is the killing effect. Not so with our product. When you put it on, it stays on, and for that 4-hour period, when you shake somebody's hand or you grab a doorknob or whatever you might do in your daily efforts, it kills that germ instantly, and so it stops from coming back into your body. So we're excited about that. We're working with a group in China right now on that. We've submitted all the documentation to the Chinese customs officials, and we hope to hear very shortly on an approval. And once we get that approval, then we'll begin exporting product to China.
So are you also working with Taiwan? No, I'm sorry. That's a bad joke.
This is not the Donald Trump hotline.
Well, now are you gonna seek application to Trump Care? You know, I mean, we've gone from bad to worse.
Well, we've actually, you let the cat out of the bag. We've already trademarked that. No, just kidding.
Yes, I'll bet you have. Oh my! Well, that's interesting. Okay, so you're how is the progress going with the Chinese government?
Well, as I said, it was a big file, a big documentation. We had to get the files both from the manufacturer in Canada and from the Canadian government to supply the product. This approved, I said, in Canada and manufactured in Canada. So all those have gone off to China, and then they're presenting them as we speak. Have presented them, I should say, and now we're waiting to hear back. So it could take 30 days. We're hoping that it'll be that time frame so that we can begin accepting orders in January.
I mean, this almost, you know, it's funny. Your product, when I run into people and they say they've heard the show, and they say this product seems like just common sense that should be used in every situation where you've got hospitals, where you have ambulances, that kind of a thing. It's anything, sports venues. It's a real no-brainer.
Oh, yeah, that's exactly what I was going to say. It's a no-brainer. You're absolutely 100% right. And it's a lotion. It's easy to apply. You don't feel it when it's on. Just to know you've got that extra layer of protection is really, really important. So at the same time in Canada, well, we have a website set up, dermsafe.ca. You can buy it from there, CA being for Canada. And we can sell it and ship it anywhere from Canada. We have a fulfillment center there. But we are aggressively working with distribution companies in Canada starting in January, and once the Christmas season's over, and we're excited about that too. So we'll be driving revenue there as well.
Okay, so if somebody, say, no matter where they're hearing the show anywhere in the world, they could actually pick it up on dermsafe.ca, which is Canadian?
Correct, yeah.
Cool.
Yep. Boy, yeah, they can pay for it right there and go online and order it, and it will be shipped directly to them from that point, yeah.
Boy, that sounds amazing. So what else is going on with you guys at Skin Visible?
Well, the other big thing that we've been talking about is we have signed a license agreement with a Las Vegas company that's part owner of a marijuana cultivation facility to develop a line of, I'll call them topical skincare products using both CBD and THC, the two ingredients in marijuana. And where we're at on that right now is we have developed both a topical product and we've developed a transdermal product. The topical product would treat skin conditions, and will absorb, of course, into the upper layers of the skin to treat certain skin conditions. The transdermal product would go right through the skin into the bloodstream to treat a lot of other conditions. And again, these are not FDA-approved situ products, etc. So even though they're approved by different states, so I don't want to make any claims. I just can only claim what I've read and what other people are saying. And certainly the topical product would provide anti-inflammatory properties, and are doing right now as we speak. The benefit, though, over any other product that might be out. And by the way, I'm just reading this morning. This industry is just, now that we have approvals here in Vegas and in California, it's projected to be a $20 billion market by 2020.
Oh, sure. Yeah, there's no doubt about it. Yeah.
Oh, just huge. So we're in that. We've developed these two products. They are excellent. We'll be putting news out on them shortly. And our licensee, our agreement with our licensee is that we will develop them. They pay for everything for development. They pay for all the licensing. And then what they'll do is they will go out and they will, you cannot manufacture products in one state and cross-border into another state. So they have to be manufactured in every state. And so while we're working right now with and have developed these products with CBD, within 2 weeks we'll be moving into their facility so that we can begin to work with THC, which is I'll call it the happy one, the one that works on the brain, the receptors in the brain.
Yes, yes.
And, pardon me?
Yeah. Do you need any researchers, by the way? Oh, I'm sorry.
I'm sure there'll be lots of them out there. So we'll be beginning work on that in their lab because, of course, we're not DEA approved here. But we'll be working. We've done the work with CBD from hemp, and now we'll be working with both CBD and THC from the marijuana plant in their facility, and they're building a whole new lab for us, and our chemists will work out of there. So we're very, very excited about that. Then what happens once we develop these products, I'll probably have them done by the end of Q1. We'll start licensing out in California, Nevada, Oregon, Washington State, Colorado, other states that are approved. And I think there's 28 now states approved.
Yep.
Manufacturing rights to manufacture the product and to market and to sell the product in those states.
Boy, that sounds amazing. Yeah, and you think about, I was just seeing some of the recent stories, like on 60 Minutes, of what it's done economically to these various either states and or some of the cities that are involved in cultivation. And it's truly amazing what it's bringing to the bottom line. I mean, it really is. Yeah,
and of course the taxes and everything else, and of course the health of the people. The big difference, of course, between us and anybody can develop topical products using these, but if we remember, it's the Invisicare, it's our patented delivery system. We use the term that we can almost control the release of the active ingredient out of the solution onto the skin and through the skin, and that's a real plus because we can bring real science from a pharmaceutical company to this industry, and we're very excited about that, as is our licensee.
By the way, your sun product works amazing. I think this is the first year that my dermatologist doesn't have to cut my face up. So
yeah.
It works great.
That's a good year then, yeah.
Yeah, it is.
No. So we have the two big things right now are the Derm Safe and the potential for that hand sanitizer going into China with a population of 1.6 billion people. Again, that hand sanitizer kills both bacteria and viruses, all the influenza A viruses we've tested, H1N1, H5N2, H3N2, I should say, H5N1, bird flu, swine flu. And so we're very, very keen. I think that product's developed, it's done, there's no more R&D on that. It will just be sales now. And so that's what we're excited about the first quarter on that. And then the other one, to be in our marijuana licensee and working with them and getting this product developed and getting it to market as well. We have the manufacturer lined up for the hemp products, and so we're and we're getting, by the way, lots of interest. And I just note this morning a big press release out on a Canadian company in our space, amalgamated with another company, has a market cap of $300 billion, $300 million, dollars this morning. So this industry is giving good value to marijuana cannabinoid companies.
Yeah, that's really amazing. But you touched on the derm safe, and I just and like the various flus. I mean, it seems like a lot of them that you hear about, whether it was like bird flu or whatever, all seem to come from that part of the world, in the Pacific Rim. And if you can get in there with this product, I mean that really, really would serve you well.
Yeah. Oh no, there is absolutely no doubt about all of that. And as I said, we've got a lot more that we can't talk about, but we're very excited about, of course.
So what are we looking
all
at?
of this,
Go ahead, Mike.
all of your products are can be made in Nevada, but they can't be transported across state lines, right?
That's right. So what we'll do, Mike, and it's a good point. So what we'll do in California, we're looking for a licensee that would like to manufacture the cannabinoid products in California for sale only in California. And so that's what we'll be doing there. Now you think about it for a second, how big the market is just in California. Just in Los Angeles County, there's over 1,000 dispensaries that are selling medical marijuana. 1,000.
Wow.
And very shortly they'll be selling recreational, of course. But you think that's 1,000? That's like 1,000 CVS's or 1,000 Rite Aid stores. And when you put your product in there, and if you do it right, and you have the technology that we have, and you have the smart sales rep that can show the product, and I think it just can be a win-win for every party that's involved with us, including our shareholders.
Wow, that sounds amazing. So you, in theory, then, would have to get a manufacturer in every one of the 28 states then to do
Correct.
This? Yeah. Okay.
Correct.
Yeah. So nothing goes. Yeah. And sooner or later, I mean, it's gonna, get federal approval. I mean, it's got to happen. I would think. I mean, who knows now? But
Who knows? Yeah.
One would think that makes common sense that it would happen anyway.
Yeah. Yeah. But the thing is that, again, we're a worldwide. This is our first step. Was could we do it? Could our polymer delivery system deliver CBD? Could it hold it in solution? Could it deliver it? And the answer is yes. That was very exciting for us. The second is then, of course, getting into the lab to work with THC from the actual marijuana plant itself. And then beyond that, then we have calls this week looking to do further research with major corporations, major pharmaceutical companies who want to go the route of delivery of THC to the brain and work on all of the indications that are out there that it can help with. Again, not getting my neck out here, but all of the indication from Parkinson's and whatever else that you read about.
Sure. Oh yeah. It's been major
particularly
news.
out of Israel.
Mm-hmm.
Lots of research out of the universities.
There is. Yeah. And I've been reading some of that. Yeah, it's fascinating.
Yeah, so that's where we want to go once we get products on the market and get our name out there.
Do you ever get a feeling? You start reading a lot of the stuff. And a lot out of the Eastern Bloc as well. So various sets of research, out of Japan and places like that, and that sometimes you wonder if we're a third world country over here. I'm serious. You just hear all of this, really futuristic kind of stuff going on overseas, and here we are just kind of plodding away.
Yeah, well, we really, we protect the public for sure.
Oh yeah, there's that's got to be the first thing. Well, tell us a little bit about Kintari. How's Kintari.com going for you?
Kintari is looking very good as well. I know we haven't talked about it, but we have. I got to be careful. We have some stuff happening as far as the overall company goes. The products are selling well, but we have some interest on some other things with Cantari, along with what we're doing right now, which is very exciting for us. And hopefully by January we'll be able to make some news on that too.
Oh, okay. That sounds interesting. Well, some of the other products too. I mean, whether it is the sunscreen, or just tell folks who may be listening for the very first time. I know you've been on for years. How many different areas you're into, because it's actually a lot.
Well, okay, thank you. Actually, what we're a drug development company. We have developed a proprietary technology for delivery of drugs, both topically and transdermally through the skin. We have 14 patents around the world on this technology, and so we've developed over 40 products in-house here in our own lab. Dr. Rizal has, both from the point of view of prescription products, RX, over-the-counter OTC products, like you mentioned, sunscreens, and also cosmeceutical products. And we have licensed out some of those products over the years, and some we still hold in-house here and are talking with various companies on licensing them out as well. We also hear from companies from time to time, pharmaceutical, who will come to us and say, we've heard about your technology. Could you take our active ingredient that we're now selling, our product, take our active and give it a new lease on life, so to speak. In other words, a better delivery system, a new story to tell, etc. And maybe it's even coming off patented because we're patented. Can we get a brand new patent again? So we work with that, and that goes on and has over the years. But that's really what we are. We're a drug delivery company with a proprietary technology, patented. Our main space, of course, when you talk topically, is in dermatology. And just one second. Pardon me. And you mentioned sunscreen, and that sunscreen that we developed, an SPF 30, 50, and a 15. Again, when you develop sunscreens over the counter, the active ingredients you use are set by the FDA. They tell you what you can use in there, and only what you can use for UVA filters and UVB filters. And so there's no science there. Everybody uses the same ones. What we're able to do, though, because of the polymer technology, UVA, which is what you use there is avobenzone for UVA, that's the active ingredient, and typically breaks down in 2 hours. So every sunscreen that you buy, I mean, if it isn't on there, it's supposed to be on there, it says reapply every 2 hours, because it breaks down in the sun in 2 hours. So for protection, reapply. We did a study, and actually the study was stopped at 8.5 hours, with 100% coverage on UVA on the avobenzone did not break down for 8.5 hours. And so we've got a lot of anecdotal evidence of people said, hey, I've used your sunscreen over the last summer here. I used it once. I golfed 36 holes. I was out in the sun all day, whatever it is. I never had to reapply it. Now, I can't make that claim, and I'm not making that claim. I'm just telling you what they're saying is that this product seems to be a superior product. Our sunscreen, which we call Skinbrella, to what's on the market today. And we've got lots of letters and emails from people telling us that as well. And if you go to our Cantari website on Skinbrella, you'll see videos on there of people who are making claims and actually showing how on one half of their face they put an SPF 60 on, the other half they put our product on, and even the SPF 60 burned out in the sun in less than an hour, and of course ours fully protected. So
and
that's what the technology does.
Yeah, that's amazing. Yeah, and folks, obviously, if they go to the OTC QB, they'll find you, right?
OTCmarkets.com.
Yep.
And then put in SKVI, and you can get all the information.
Yep.
OTCmarkets.com.
Yeah.
How do the CBD and the THC in marijuana interact with skin cream? How does that interact?
Well, what we're doing is when we take the CBD, it's just a delivery system to get it to the skin. because you can't, I guess you could put it on with just straight oils if you bought it, but it would be very, very expensive. So you take it in a formulation like a skincare to put it on to make, and you have to make sure it's released out of the solution to get to the skin, of course, or there's no point putting it on. And the same with the THC, but the THC you need to get to do what you want it to do. It works with the receptors in the brain, so you want to get it into the bloodstream to get to the brain. So that's therefore, if you have a transdermal that passes through the skin layers, it'll go into the bloodstream and then into the brain. Now you can get them also, as you know, by smoking it, or you can get it in there as well by taking the cookies and gumdrops and this kind of stuff. They have all different kinds of names that you can buy like that too, to get it in there. Now that goes through in that case it goes through the gut before it got in the bloodstream. Ours would go right into the bloodstream.
Wow.
Does that answer that, Mike? Yeah.
Yeah, that's just the technology today is just off the charts. As to what you might be able to do, especially in the medical marijuana area, and the fact that it helps some people. I guess it must be working somewhere.
It sure is.
I think the thing is to know that Skin Visible is that we do not develop any new drugs. We're not about a new drug development. We're just about a better way to deliver the existing drugs that are out there to the skin, and hopefully, in addition to the patents we have on the polymer delivery system, getting more patents and give protection to our clients, our licensee clients.
So, Terry, how many of these companies, that see their patents kind of, about ready to waft away, how many of those big guys come to you and just say, hey, look, help us out here?
Oh, in a 12-month period, maybe half a dozen.
Okay. Yeah.
Yep.
I think that's phenomenal, and I think it's fascinating that somebody in those organizations would say, okay, Skin Visible is there, they can help us out, with the polymers. I think that's great.
Yeah.
So what?
Very, very good.
So what? As we're right around the corner of heading into 2017, what are the goals for Terry Howlett, the president and CEO of Skin Visible, in 2017 and 2018?
Well, our goals are to continue doing what we're doing, only do it better, sure. And to get these products on the market, get Cantari products on the market in a bigger way, get these marijuana products out through our licensee and get them on the market, and finish up our development Q1, get them in the market in Q2 to drive revenue, and of course Q1 to get DermSafe going both in Canada, sales-wise, and into China. And by the way, DermSafe also has interest from some other countries in South America and in the UK now too. So we're talking to those companies as well to see if, again, can't get better distribution or get better distribution, because the products are made, they're available. It's just a matter of getting the customers to buy them.
Yeah,
so we're all about revenue next year.
There you go. Sure.
Yeah.
Yeah, it's you've got a great story, and I just think that the more and more people hear about, especially the DermSafe product, I think that is just a truly amazing product that just needs to be all over the place.
Yeah.
Now, you were talking, maybe 6 months ago or something, where some sports franchises in Canada were kind of looking at that.
Well, first of all, we provided to all the Canadian Olympic athletes competing in Rio because of the dirty water conditions.
Oh, yeah.
And we got approval on that very quickly from the medical director, because, of course, every doctor knows all about chlorhexidine glutamate, because it's used in all the soaps, in all the scrub-up rooms, in every hospital worldwide, and has been for 60 years. So they know about that. It was just like, okay, we're in. And because of that, we got accepted by the Canadian Football League, and right now we're in discussion with several NHL hockey clubs. And of course, the exciting part about that is that's exciting, but that filters down then to junior hockey in Canada and right down to Pee Wee hockey, and there's millions of kids playing hockey in Canada right now, so we can get it all the way down into there. Now that's just one part of it. I mean, that's just one. You said it. I mean, this should be in every public arena. Everywhere there's like you walk into a bank, it should be there. You go to the nursing home to visit somebody, it should be there. So you put it on when you put it in before you go in, because you're going to be there for 1 or 2 hours. Now you don't have to worry about it. You pick up another germ somewhere. You're not going to bring nothing in, and you're not going to take anything out. No, and I can't go into more, but we're very excited about what we're talking about for Canada for the Q1 or for January on this product.
Well, see, now, you talk about some of the hockey stuff. I mean, you have to hit the preschools hockey teams up there. I swear, I was kidding with Wayne Gretzky once. I said, "Are babies born with hockey skates?" And he said, "They sure are in Canada." Oh.
That's right. I'm originally from Canada, so I can speak like that.
No, it's so true. It's really amazing. But that's where that really does come into play, because it's just we run into situations all the time with our college basketball team that I broadcast for, that that you could really utilize something like this. The trainers could.
Sure they could. Yeah.
You just don't know with the sweat, certain blood incidents that occur during games naturally, and of course hockey being a big thing like that. I mean, there's all sorts of areas where this could really benefit sports.
It should be in every locker room of every. Well, I don't care what sport it is. Everywhere. I mean, you remember? I think it was last fall when one of the players for the New York Giants came down and picked up MRSA.
Yep.
Picked up MRSA and came close to dying from it, and yet our product kills MRSA. So should it be in the locker room? Darn right it should be in the locker room.
Yes. Yeah, and I'll tell you.
It should be in every restaurant. Yes, it kills E. coli on contact. It should be in every restaurant.
Yeah.
So.
Yeah. I know this, going back to the early 90s when I was still in Los Angeles in television news. I had done some stories on how artificial surface, holds on to various diseases, and players can pick up like a MRSA type thing just from the plastic surface there. And you are right. I mean, that's where this could truly be a lifesaver. And boy, you're onto something. It's invisible, Terry, and. Boy, you've been a friend of this show for a long, long time, and we certainly wish you well. And, boy, you have a you've already had a great 2016. Hopefully looking forward to a real good 2017 for you.
Well, we appreciate that. We thank you very much as well, and we look forward to a good Q1 so we can give a good update to all of our shareholders.
There you go. Okay, Michael, do we have any legalities here that we need to get out of the way here before we move out of the way?
No, we're paid in shares of stock to do investor relations. And we've been doing investor relations for Skin Visible for many years.
Yep. And, well, we can't thank you enough. And, Terry, thanks for being with us. Mike King, Charles Moscowitz, PrincetonResearch.com. Get that newsletter. It comes out every Sunday. Boy, what great reading. You just really need to kind of sit down and take a look at this. PrincetonResearch.com. Subscribe now. Money Info brought to you by Princeton Research. We'll be back again next week right here on WPSL, Port St. Lucie.